My name is Brian Lee. I am the physical therapist for An American in Paris on their first national tour.
My name is Brad Schlakek.
My name is Weston.
My name is Brittany Bone.
My name is Alexa DeBar.
My name is Marina Lazaretto, and I'm a swing at American in Paris.
I am a female ensemble dancer.
I'm an ensemble member.
I'm a swing.
And I am in the ensemble of American in Paris.
I've never worked with dancers before. The closest thing that I have had to working with a dancer is probably a gymnast, just from the flexibility standpoint and some of the different movements that are required in their sport. I think now that I've been on tour for about 6 months now, I've really picked up a lot of the dance terminology. I've learned a lot about a dancer's body in general as well. Learned about their natural tendencies, asymmetries that tend to develop in them based off the common positions that they assume while they're dancing. So I really just think that my overall understanding of a dancer and the movements that they perform on a daily basis has improved dramatically. I will start working about 3 hours before showtime, and that is to allow the dancers to come in, get some treatment, and then give them time to still get their bodies warmed up with whatever routine they may have. So the majority of the treatments that we're doing here on tour are really manual therapy based. So I do anything from soft tissue mobilization, dry needling, myofascial decompression, joint mobilizations. All of that is designed to help the tissues lengthen and get warmed up so that when they go on stage, they're not feeling any restrictions or impairments.
I started dancing when I was 6 years old.
I started dancing when I was 7.
I started dancing when I was about 8.
I went to the University of Arizona in Tucson, Arizona.
I have been dancing professionally about 12 years now. I started out in a small company in New York City, and from there I moved into musical theater to West Side Story, and that was my first musical theater job.
Taking care of my body has changed dramatically from the start of my career to now.
I think that as you get older, you sort of start to realize the importance of taking care of things. When you're young and your muscles are supple, you can sort of just do whatever you want cold and you feel okay. The older you get, the more brittle your muscle tissues get and your ligaments. So taking care of yourself, warming up properly, taking care of injuries in the early stages becomes increasingly important.
As a dancer, any type of new dance that you learn will affect your body in a different way.
I do a lot of lifting in my track and moving a lot of heavy sets. I'm dealing with some neck and shoulder injuries, strained bicep, facet joint neck problems that all have to do with overexertion and overexhaustion.
Currently we do 8 shows a week.
We do a week minimum.
We basically perform Tuesday to Sunday, and Mondays are our day off.
And so we have one day off a week, which are Mondays, which are also our travel days. So that gets really tough on the body because you're traveling, moving suitcases, and then the next day you have to do a show again and do 8 shows every week.
I think that when you do anything multiple times over and over again, there's a risk of overuse injuries. Touring adds an extra layer on top of that in that we're always moving around. So, you know, the added stress of sleeping in a different bed every week, flying, being on buses, sort of gives your body extra demands that it doesn't normally have.
The best thing that a dancer can do while on tour is to be proactive in taking care of their body. Because they're performing the show 8 times a week, they don't really have an opportunity to get behind. Because if you injure yourself on Tuesday, or you start to feel some symptoms on Tuesday, you have to perform the show Wednesday, Thursday, Friday, 2 shows Saturday, and 2 shows Sunday. So you don't really necessarily have a full opportunity to recover. So the best thing that you can really do is to just be proactive and try to prevent anything from developing.
It's nice to talk to a physical therapist about what you're doing on stage, especially if something's hurting, to make sure that you're using your muscles correctly and doing the correct thing to prevent further problems.
It is very rare for a company to have physical therapy so easily on hand. And the fact that we're given that benefit is amazing, because there's just a wealth of knowledge that is at our fingertips, that if we want to take advantage of that, then it's there. And especially when you have someone like Brian, who is so eager and happy to come forward with help, it makes it an amazing time.
I think physical therapy is absolutely a necessity for me. First of all, it helps you assess what's wrong if you have an injury, but also in terms of maintaining your body and preventing injuries.
I find physical therapy to be a necessity as a dancer.
Yes, I think physical therapy is most definitely a necessity for me as a dancer.
It is the most important thing that I can receive as a dancer and as a performer.